loss, hair growth, and your hormones. I'm going to touch on a few other areas as well. I'm going to touch on nutrients. So I will do that towards the end. Now, I've got a lot of questions from you all. Personal questions around your own journey, your hair growth, what's been going on. So what I'm going to do is I will probably do a separate video with a couple of the questions, because otherwise that'll make today's probably too long. So today I'm just going to give you an overview into hormones. Which are the main triggers of hair loss and issues with hair growth? What's actually happening? I'm going to talk about your thyroid. I'm going to talk about estrogen, progesterone, polycystic ovarian syndrome. Just some general nutrients that you can use to look after your hair. General nutrients in the diet, things you can do to support hair growth. So we're going to go through this today. There's quite a lot, so I will try and break it down so it's super simple for you. And like I said, the questions that I've received, I'm actually going to do a separate live. I'm going to do a separate video on polycystic ovarian syndrome, testosterone dominance, and hair, because I think that's a huge subject. So I am going to do that one. But for today, let's focus in on these hormones and get started. So when it comes to your hair, there are different hair growths. You've got the anagen phase, which is where the hair grows, and that's 2 to 8 years long. Now, that's the length of the hair. That's how long it grows. Now, if that phase, that's the first phase, if that phase is interrupted, it can cause an issue with hair loss, but also it can cause that issue with the hair not being able to get that length. So I know some people find it very difficult to get length in that hair, and that could be because they've got that short anagen phase. So the anagen phase is where the hair is growing. For some people it can be 2 years, some people 8 years, and anything in between. Your hormones, your general health will interrupt that phase as well, and will cause that phase to either shorten, and so you actually end up with less hair, less length in your hair. The catagen phase is kind of the phase where the hair follicle starts to shrink. So the hair follicle, so in the anagen phase, when it's growing, it's taking up all the nutrients, all the minerals, all the vitamins. When we get to the catagen phase, which lasts around 2 months, up to about 2 months, the hair follicle is shrinking down, and so the nutrition is not getting into that. So then it's getting ready to shed. And so you can see, we have that kind of natural shedding every so often, the natural shedding of the hair. That can happen for some people every 7 years. I don't know about you, but I feel like every so often I do feel like I've got more hair shedding. Now, different people have different types of shedding. I actually get a lot of kind of like baby growth hair here. And what the baby growth hair here, it shows that I don't have an issue with hair growing. So I don't have thin hair. So I don't have an issue with my anagen phase. The anagen phase is the hair growth. What I have an issue with, and there's a kind of like a disparity between that kind of catagen and also telogen phase. The telogen phase is where you're more likely to suddenly shed the hair. So my phase, for some reason, is sped up, where I'm losing the hair, but it's still growing. So for those of you that have lots of baby hair, that's nothing to do with the growth of the hair. That's more that something's interrupting the loss of the hair. It's causing that to happen more regularly, and you're having that hair shed. So it's quite interesting looking at that and actually looking at how your hair distribution, the type of loss, how long it is, how short it is, the quality of the hair can give you a good indication of actually what's going on. Now, normally what we've got kind of like acute hair loss. So this is where the anagen phase is where the growth phase. This gets interrupted. So something interrupts the growth of your hair. Okay? So this could be, I did have a list of medications actually, but I've actually, I forgot to print them out. So I will give you a list of medications that do interrupt the anagen phase. So I think it's really important, because you might be on medications that you don't realize interrupt this phase. So when the anagen phase is interrupted, what you'll find is in the next 2 to 3 months, you have a mass shedding. So mass hair loss. So this can be caused by acute stress, post-traumatic stress, stress emotionally, stress physically like surgery, it could be an injury, it could be an illness, Studies show that a high fever will cause, the next 2 to 3 months, that phase will be interrupted. So then in about 2 months, you have that shedding. So in kids, that can happen a lot when they've had a really high fever. So think about that. If you suddenly have a mass shedding, it's more that growth phase has been interrupted, and it was probably something that happened a month or so ago. So you can normally go back to that. Another thing you'll notice when you've had a trauma or something happen, you'll get a lump, you'll get a bump on your nail, and that can give you also a timeline as well. So this gives you all these little timelines of something that happened. So that's an illness, that's surgery, that's a huge stressor about, the death in a family, a divorce about a month or 2 ago, and then that will cause that shedding. Then you've got that real delayed anagen. The anagen is the growth phase. So for a long time, the growth phase is delayed. And this can actually happen with pregnant ladies. So women that get pregnant, they have more progesterone and more estrogen. Progesterone and estrogen nourish the hair follicle. They enable this sort of longer anagen phase. But then once you give birth, postpartum, you have this mass shed. And so this happens when you may have been on oral contraceptive pills. It may happen when you're pregnant. It may happen with any kind of HRT where you're having those hormones. Suddenly they're ceased. You don't have the access to the hormones anymore, and you have that mass shedding. Now this can happen after pregnancy, so it's very common for women to get that kind of diffuse thinning of the hair over. Then we've got things that happen to the anagen phase that kind of like shortens it down. This can be genetic issues. This can be low minerals. This can be low iron, low zinc. And that's where that anagen phase is actually shortened. So you can't grow your hair past a certain point. And that's actually quite common. When it comes to hair loss, the two biggest causes that are out there with hair loss, apart from we will be talking about polycystic ovarian syndrome and the distribution of androgen dominance with women, so female pattern hair loss with women, which is androgen dominance, hyperthyroidism, and low serum iron levels, and also low ferritin. When we look at the numbers, I don't know the numbers off by heart, so I'm just going to tell you when it comes to iron. Where did I write it down? When ferritin levels are less than 40, okay, less than 40, ferritin levels are less than 40. This is an increase in the telogen phase. So the telogen phase is where the hair starts to fall out. Okay, so if you have your ferritin levels done and it's less than 40, you're more at risk of having that actual hair loss. Okay, and then also the next number I wanted to give you was when serum levels, the androgen phase is only at its strongest when your iron levels are over a certain. So depending on what you're looking at, if the iron levels are up to 200, you need it to be over 70. If the iron levels are up to 30 in your testing, then you need it to be above 18. So have a look at your iron levels, but serum iron levels, if they are too low, then the anagen phase is going to be interrupted. That's that growth phase, okay? So that's the growth phase, so the hair won't grow as long. You might have that mass shedding, and then it will take a while to grow back. So iron is huge, and you can get your irons tested. Get your ferritin, always get your stored iron, always get your serum iron. Other signs and symptoms of low iron are recurrent infections, restless leg syndrome, anxiety, depression, things like pneumonia, heavy painful periods. All of those are signs of low iron. Some people have the pale in the face. Some people have issues with the moons on their fingernails. And also ridges on your fingernails as well. So iron is a huge one. So remember that it interrupts both phases. When it's low ferritin, you have more shedding. When it's low serum iron, you'll have less growth in that first phase, that growth phase. So that's what can be happening. And if they're both low, you'll have the more loss with the least growth. Hyperthyroidism is one. I'm going to touch on that in a moment. Estrogen receptors. So women with a low estrogen. Now I know I talk a lot about estrogen dominance, but estrogen is very, very important. I'm going to talk about myself for a second here because it will give you an indication of how even imbalanced hormones can cause positive things. So I tend to be more testosterone dominant and also estrogen dominant. And now because I'm a bit dominant in both, it's kind of like they weigh each other out. They weigh each other out. So my testosterone doesn't turn to DHT, dehydroxy testosterone. It doesn't turn to DHT, which is the stronger form of testosterone, and this is the one that causes that hair loss in women. I'm going to talk to you in a moment about that. If you've just got high testosterone by itself and you don't have elevated DHT, then you'll be less likely of losing hair. Now, what this will look like with female pattern hair loss, okay? This is a different kind of hair loss. It's a hair loss where it doesn't grow back. You don't get these baby hairs. These baby hairs are more thyroid and more iron. When it's due to your androgens and when it's due to your DHT, you'll get thinner here and you'll get thinner across the parting. So you'll start to get a thicker parting and you won't have that hair growing back. So the parting gets thicker between the parting. You start to see your scalp and you're not getting the baby hair. That's a lot to do with your DHT and your testosterone levels. So you might have thicker hair around here. You'll start to thin here, no growth, and you'll get that thicker parting. You'll also notice that hair itself, the hair shaft will start to thin out. So it will get more kind of flossy baby hair. That will start to thin out. Now that's to do with your testosterone and your DHT, and I'm going to talk about that in a moment because that comes with issues like polycystic ovarian syndrome, and so we'll touch on that in a moment, but that's what to look out for. So when it comes to my hair, I'm actually a bit estrogen dominant, so I tend to have that thicker hair. So when you've got a good level of estrogen but you're not too dominant, you tend to get thicker hair growth, and so that's the beauty of that. So when it comes to female pattern hair loss, I just want to touch on this for a moment, and male pattern balding, certain types of balding are due to the same thing. So when it comes to men get hair loss due to a couple of different reasons. One is too much DHT, and again, that will start to happen from the front. But when men have too much estrogen, they'll get a different distribution yet again. So they're similar hormones. It can be similar hormones and it can be that DHT, but there's a particular pattern to it. It's that thinning, you know, the thinning there and the thickening of the parting as well. So if you've got low estrogen, if you've got extremely low estrogen, whether genetically you've got low estrogen, whether you're postmenopausal and your hair's thinning out, you want to look, and you're maybe having problems maybe having problems growing your hair as well. You know, when women get older, postmenopausal, their hair tends to be shorter, it's more difficult. That can be estrogen issues. So that's when you want to look at bringing foods kind of that are balancing estrogens into the diet. You want to look at bringing in, you know, your flax seeds. You want to look at maybe bringing in certain types of legumes, those kind of things to just help to balance your estrogens. And also black cohosh postmenopausal can be good. If you've got those kind of low estrogen, it's a thinning of the hair and you know that you have got those low estrogens, or maybe your period has stopped. Now, your estrogen to progesterone ratio is a huge implication here as well. So progesterone is one of the most important hormones to nourish the hair. And so what I've found is women with lower progesterone can get grey hair. Now, progesterone nourishes the hair follicle. So what you get when you get low progesterone to elevated estrogen is you get hair loss, but you can also get greying of the hair as well. So the estrogen kind of negates any of the good stuff that the progesterone is doing. So you need that good balance there. You need the good balance. Now, also what can happen to some women who have estrogen dominance, and this can happen with endometriosis as well. Estrogen dominance doesn't just mean you've got elevated estrogen, it can also mean you've got elevated testosterone as well. Because what happens is through stress, through high blood sugar, through endocrine disruptors, they cause your estrogen to elevate. And then your estrogen has a couple of options here. It can stay as estrogen, or it can go through your body and it can convert and you can excrete it. Or it can be a bit sneaky and it can turn into testosterone. So the more you bolster your estrogen levels, and you've got things that you're exposed to that increase your estrogen levels, the more likely you are also to bolster your testosterone levels as well. So you need to be very careful with your estrogen and progesterone balance. If you know you've got low progesterone, what you need to do is you either need to work on elevating it using herbs like Vitex, Chaste Tree, B6 is very good. Or what you need to do is you need to really go to the root cause. And the root cause here is inflammation, and then you need to go to the root cause even further. Is it high blood sugar? Is it insulin resistance? Is it toxins or heavy metals? Those are normally the most likely root causes that are causing your estrogen dominance and then maybe causing your testosterone dominance, and then that pushes your progesterone down. And stress as well. Sorry, I haven't talked about stress, but stress is huge. So when it comes to your hormones, just knowing the difference between what it will look like between estrogen and progesterone and testosterone. So with that testosterone dominance, you've got the thinning here, you've got the thinning here. With estrogen dominance, you'll have that kind of cyclic shedding, and with estrogen dominance, you probably won't get very thin hair. So your hair will actually probably retain its quality and it won't get as thin, but you will have lots of shedding. With iron, with low iron and low ferritin, you'll notice that you'll have lots of baby hairs, okay? Like I do. I have baby hairs. And with mine, they're curly. So if I put my hair back, I've got those kind of corkscrew curls at the front. And that's the baby hair. People think it's just breaking your hair with brushing, but you'll notice that it's just the process of the hair growth is a bit wonky. You've got some long and some short. So that's what's going on there. You can also get estrogen resistance, and this is a biggie when it comes to hair loss. Estrogen resistance can cause estrogen dominant symptoms, but estrogen resistance can also cause a lot of hair loss. So estrogen resistance is where toxins, particularly heavy metals, BPA, cortisol, and insulin all block the receptors of the estrogen, so it's unable to support the growth phase, and it's unable to allow nutrients to get into the hair shaft. So if you're estrogen dominant and you're having hair loss, get to the cause of the estrogen dominance and figure out if it's hair loss due to estrogen or hair loss due to testosterone. So those are the two, and they look very different. You'll really understand the difference between those two things. You'll be able to identify what's going on. When it comes to testosterone dominance and when it comes to DHT, which is the main testosterone, so women have women suffer a lot with hair loss here due to testosterone dominance, because we've got what's called these aromatase receptors, and these aromatase receptors, they sit in our scalp and they convert testosterone to estrogen. Now, if that process isn't working, and genetically for a lot of women it actually doesn't work, then that's going to pop that DHT up, that's going to rise in these areas, and you're going to lose that hair. Now, this happens with a lot of women who have got polycystic ovarian syndrome. Polycystic ovarian syndrome, you can have estrogen dominance and again testosterone dominance as well, but mainly you've got the testosterone dominance, and estrogen's normally low, but not all the time, but it is normally low. With polycystic ovarian syndrome, you're most likely to get the hair loss here and on the parting line, but you may also get shedding as well. Now, some women with polycystic ovarian syndrome also get alopecia, what's called alopecia, where you get spots on your scalp and you get a hair loss from a certain area, and it's a circular area. Now, this is very common for women with polycystic ovarian syndrome because a high percentage, it's around a 3 to 4-fold increase with women with polycystic ovarian syndrome also have an autoimmune condition. Okay, so when we see circles or when we see a particular area, it's more likely to be an autoimmune condition. So that's when you have to treat an autoimmune condition, and you know how you treat. We talked about how to treat autoimmune conditions. You know, you reduce your dairy, you reduce your gluten, you check your gut for parasites, you check your gut for bacteria, you ensure you're not exposed to heavy metals, that kind of thing, because they can increase your autoimmune response. And so that's when you're getting those circles. Now, another problem with the issue with polycystic ovarian syndrome, and also which can be increased as well, and that's not talked about a lot, is women with polycystic ovarian syndrome with thyroiditis. So thyroiditis is the inflammation of the thyroid. You have problems with thyroid hormones. It normally comes with hypothyroidism, low thyroid, and can be coupled with Hashimoto's. And you will be getting hair loss as well then. That's very common, and you might even be getting two types of hair loss. Possibly you can be getting the circles and also kind of the thinning on top of the head. So look out to see if you have those two types of hair loss and what can be going on there. With polycystic ovarian syndrome, you know, you'll be getting maybe blackheads, you'll be getting maybe acne, maybe your periods will be longer. You won't be getting your periods. You might have more follicles on your ovaries. You might be suffering from infertility, but what you really want to do is you want to ensure that your polycystic ovarian syndrome isn't complicated, isn't made even more complex with thyroid complication. Because once the thyroid comes in, what happens when we have thyroid issues is it completely arrests that kind of growth phase. So the thyroid stops getting the nutrients to the hair follicle, and it completely arrests that growth phase. So I think that's really important. Not only that does it arrest the growth phase, but because the nutrients aren't going to the follicle, when you've got thyroid issues, you'll notice a lot of hair loss, an awful lot of hair loss. Now, averagely, what you should be getting about 100 hair loss a day. And there is a couple of tests you can do. I actually haven't got the number for the test to do when you wash your hair. So I'll get that number for you and actually put it below. But when you pull your hair like this, you grab a kind of like a group and you just sort of comb it like this and you pull it through, you probably would get about 1 or 2. If you get more, if you get kind of like, 10%, pulling out, that does mean there's an issue with hair loss. Another way to tell is if you don't wash your hair for this is a bit more takes a bit longer. If you don't wash your hair for 5 days and wash it and then you count the hairs, you don't want to be going over kind of like a 10% loss. That's about it. So that will give you an idea if you're losing too much hair, because like me, I've got thick hair, so I do lose a lot of hair. And I lose a lot of hair, I think, due to my thyroid sometimes goes in and out, and also sometimes low iron. So low iron most likely comes with low thyroid. But because it grows back, you don't notice it as much. But for some women, it doesn't grow back because the anagen phase is arrested, okay? So that growth phase, and that can be to do with testosterone, DHT, those kind of things. So when we're looking at things that are the main root causes of hair loss, we're looking at stress, we're looking at high blood sugar, insulin, and also heavy metals. So really have a look at those 4 kind of root causes if you've got hair loss, and see for you which one it could be. Stress. So I wanted to talk about stress quickly with cortisol. So what cortisol does is it's really interesting, and this is why stress can cause hair loss quite quickly, within weeks. This is why stress can cause hair graying within weeks. What happens when you get stressed and your cortisol is elevated is it changes your hormone aldosterone, and this changes the fluid in your body, this changes the potassium, this changes the sodium. And so when cortisol is up, aldosterone is up, and that tends to keep you holding on to sodium. Okay, so this isn't adrenal fatigue, this is acute adrenal stress when your cortisol is sky high. So very different from adrenal fatigue. Adrenal fatigue and high cortisol need to be treated in completely different ways. They are very different and need a different treatment approach. If you've been through a severe stress, post-traumatic stress syndrome, operation, divorce, or severe stress, and your cortisol goes sky high, if your cortisol is elevated, you might feel anxious, you might get heart palpitations, your blood pressure might be up, you might feel sweaty, you won't be able to sleep, you'll be jittery, it's going to be very high, you might not be able to tolerate coffee, you might not be able to relax appropriately, you can't sleep, your body might feel all tight. Your high cortisol, that causes you to hold on to sodium, so you've got more sodium in the body, you've got more fluid retention in the body, you can't drink enough, you feel thirsty all the time. And what this does is this causes sodium to pool in the hair follicle. When the sodium pools in the hair follicle, It inhibits nutrients from getting to the hair follicle. This can cause graying, quick graying, and it can also cause hair loss. You know, anything from about 3 weeks after, 3 to 4, 5 weeks after, you can get that sudden shedding and that sudden just loss of hair, and that can be due to stress as well. So that's why it's important when you go through acute stress to try and manage it. And when you know you've got very high cortisol and you've got lots of fluid retention, and you're very, very thirsty, you need to be coupling everything with high potassium diet. So you can be doing celery juice, vegetable juice, 10 mils of apple cider vinegar and water. And this is one of the reasons that apple cider vinegar supports hair growth so much, because it is high in potassium. It helps to remove the sodium from the hair follicles, support the hair growth, and the hair starts to grow back. Anecdotally, I've had clients whose hair growth, because of that, has grown back very quickly, and all they've done is the apple cider vinegar. So it shows that it can have huge impacts. So that's definitely with stress. I also wanted to talk about, we've talked about iron, we've talked about stress, we've talked about androgens, what that will do if you've got polycystic ovarian syndrome, what that will look like. Another thing with thyroid is you will get that loss, but also you will get that slightly thinning of the outer quarter here of the eyebrow. So that's with thyroid. When you've got the high androgens, you're more likely to have more hair growth here and more hair growth where you don't want it, hair loss where you really like it. So you need to be treating each one appropriately depending on what it is and where it is, and getting to the root cause. Now, other things, inflammation. So other things that can cause hair loss. Psoriasis can cause hair loss, so we're looking at inflammation on the scalp, and normally that's in one area. So psoriasis, dermatitis, allergic reactions to things on your scalp can also cause hair loss. Women that have been through chemotherapy, you will get that kind of like anagen phase abruptly will stop as well. So then you need to be working on giving your hair the nutrients to support that growth phase. And the nutrients that support that growth phase, so it's the growth phase, the anagen phase. Iron, vitamin D, and zinc are the 3 nutrients that really support that phase. Now also, their patent is pending on a topical application. So I found this actually, because arginine is a wonderful amino acid, and arginine gets the blood moving all around the body. It's wonderful for fertility problems. It's wonderful if you've got peripheral problems. But there is a patent pending on a topical arginine, which I think you can probably make yourselves if you so wanted to. If it's something you want to put on topically. Not all topical things work, and be careful with really expensive shampoos and things with herbs in, because the herbs aren't enough. You know, there's not enough therapeutic goodness in them. When you look at topically with the, okay, so it's arginine, powdered arginine mixed with sodium chloride. I don't know if you could use a different base, or you could put it in a cream or something, but the sodium chloride helps the arginine get into the follicle. Now arginine then helps blood supply, which helps with hair growth. Topically daily showed an increase in hair growth. I think this was in about 8 weeks. So once a day for 8 weeks. That's arginine with sodium chloride. And I know that's going to be brought out. I don't know when, but the patent is pending on that one. So that's quite interesting. Topically, not everything works, and they work for different reasons. So rosemary. Rosemary works topically because it inhibits that aromatase. Okay, so it inhibits the formation of DHT. So for polycystic ovarian, for androgen dominant hair loss, rosemary topically on the scalp twice a day can help. So that can be a rosemary cream, it can be a rosemary water, maybe you've got a rosemary essential oil and you mix it yourself, but twice a day has been shown to work. And it will really only work with androgen dominant hair loss, where it's thin here and thin here. It's not gonna work with every single hair loss. So you need to Think about that. So that's why shampoos maybe with rosemary and a little bit of rosemary, it's not going to cut the mustard. It's not therapeutic enough. You have to be making really therapeutic creams. You can probably make yourself much more cost efficient. So the rosemary is great for you guys that have got polycystic ovarian syndrome, high testosterone, high DHT, and you've got that hair loss that's the female pattern balding where it's thin here and here, and make yourself up a nice rosemary concoction. Panax ginseng topically has also been shown to support hair growth, and then also Schisandra as well. Another one that was interesting is onion juice. I suspect because of the sulfur, but onion juice, I'm not sure what they did with the onions. This was in a clinical trial. I've got them. Where did I put the numbers? I wrote the numbers down somewhere because I thought this was a good one too. Onion juice, I think it was after 6 weeks, showed a dramatic improvement in hair growth. Onion juice popped on the scalp twice a day though. So you see, it needs to be therapeutic. You need to be doing it daily. It needs to be done regularly, sometimes twice a day. And that helped overall with hair loss. So that was topical treatments, which are important because topical treatments. Now there is minoxidil as well, which also has been shown to help 2%, 5%. Some people get the dermatitis and dry scalp, but it has been shown to increase hair growth, so that can work. But when you stop it, the hair does fall out. So when you're looking at supporting your hair, zinc is one of the most important ones. Essential fatty acids, if you've got low essential fatty acids, fish oil, omega-3, omega-6, your essential fatty acids in avocado, fish, grass-fed meat, algae, that kind of thing. You've got this interesting thinning of the hair, but your hair also might be very dry. But what actually can happen when you've got low essential fatty acids is your hair lightens. You get a lighter colour. So if you're really dark, you might go light brown. If you're light brown, it might start to go lighter. So you might notice these sort of different colours in your hair from dark to light. So that's an interesting one. So other areas, and I was also going to mention, so zinc, your B vitamins, your vitamin D is very, very important. If you've got low vitamin D, again, you will lose hair. This is why some women lose their hair in autumn time, coming into winter. You have that kind of shed as well. That's that seasonal shed, but it can be that transition in the season. So vitamin D is very important. Laser helmet. So I was looking at the studies with a laser helmet, and there are studies that have been done. The laser helmets vary in price. They start at around $800, but they have been shown to work. The laser helmets can stimulate the growth. You obviously use them daily, along with removing inflammatory factors, along with removing, issues with toxins, issues with heavy metals, balancing your blood sugar, making sure you haven't got high insulin. And then taking zinc, taking iron if you've got low iron, and then you can use the helmet. Another supplement is biotin. So a lot of people take biotin, and studies have shown if you've got hair loss or you've got poor hair growth due to if you've got poor hair growth due to low biotin, then biotin will help. 1 milligram a day for 6 weeks has been shown to support nourishing the hair follicle. So normally with biotin, it's less about the hair loss and more about the quality of the hair. Estrogen in the liver. So if your liver as well, if you've got estrogen dominance and your liver is not clearing the estrogen, then that's going to cause issues with the buildup of estrogen, and that's also going to cause issues maybe then with testosterone. So, but definitely the liver. So if your liver is not clearing the estrogen, you're more likely to have issues with hormones, and then you're more likely to have issues with hair. Now, estrogen dominance itself won't be the primary cause of hair loss. It's actually what's happening to the estrogen once it gets dominant. Is it turning into testosterone, then turning into DHT? Is your progesterone also low as well? So when it comes to your hair loss, we've gone through a number of different areas on how to kind of try and identify what your hair loss can be due to, and also nutrients that you can take. So how I would break it down, I'm going to actually do a separate one on polycystic ovarian syndrome and the connection between thyroiditis, autoimmune conditions, and then hair loss, because I think that deserves a whole session to itself. But when it comes to this, I think the first step is to identify what kind of hair loss have you got, and also the quality of the hair. Is it thinning? Is it strawy? Is it dry? Is it due to nutrient deficiency? Is it due to an autoimmune condition? Is it female pattern balding, so it's due to androgens? Try and figure out what the hair loss is due to. If it's just simple thyroid, it might be some shedding and then you might have some baby hair. If it's your ferritin, if it's ferritin levels, you will have short hair and it erupts the growth. If it's serum iron, it's less likely to grow back, so you'll have thinner hair. So with me, for instance, so baby hair is less likely to be serum iron and more likely to be stored iron, because it's growing back but slowly. So here's what I would do. I would definitely take zinc, and I would definitely take vitamin D to support hair growth. I would also test to see what your iron is. Also test to see what your iron stores are. They are your ferritin stores. And then also take something that supports the blood flow. So arginine is very good. You know, ginger is very good. It just supports all the blood flow. So just doing that. Then remove the inflammatory items from your diet, from your lifestyle. So, you know, PBA, toxins that go on your scalp, hair products that go on your scalp that have toxins in, BPA, phthalates, all of those kind of things that will also interrupt the process of growth. So you remove all of that and then try and get to the root cause. Stabilize your blood sugar, look at heavy metals, look at toxins, and then also have a look at your stress levels and work out whether it is high cortisol that you need to be dealing with, and then maybe just bring in some more potassium into your diet to support your hair. And I think apple cider vinegar, I've seen apple cider vinegar can work really well to actually support hair growth, and that can be also due not only because of the potassium but also because you're supporting your digestive system. So if you're absorbing nutrients, you're going to be supporting your hair growth. So you need to be working on your digestive system as well, maybe with apple cider vinegar, maybe with hydrochloric acid. If you have done everything, if you have a diet that's low in inflammation and you use all natural cleaning products, you're still getting hair loss. You look at your iron, look at your thyroid, look at your hormones. If you know you've got hypothyroidism, you need to be supporting your thyroid with iodine, with selenium, with tyrosine, with B6. If you know you've got polycystic ovarian syndrome and you know that you're losing your hair is like an androgen, it's androgen dominant, your DHT, then you could be doing something like rosemary on the scalp. You could be taking some saw palmetto. You could be taking peony. You could be taking licorice to support and ensure that your body is not turning testosterone into DHT. You could do that. So when you know what your hormone deficiency is or hormone imbalance is, that's when you need to start working on it. So that's if you've done everything. So I know some women that have wonderful diet, they've done everything, but there's still that loss. So look towards the iron, look towards the androgen dominance, and look towards the thyroid issues first. See which ones are going on and then start to treat those effectively, and make sure you're giving your body enough nutrition, and make sure you're taking a hydrochloric acid, so any supplements that you do take are being absorbed, and that includes apple cider vinegar as well, so you know that everything's being absorbed. So that's it in a nutshell, and there is a lot to cover there. We've covered the different phases, we've covered androgen dominance, we've covered estrogen versus progesterone. I know myself, hair loss in the past. Okay, so we got a question here about dandruff, and if it's on the scalp, will it cause hair to fall? Dandruff itself won't cause hair, dry scalp not necessarily won't cause hair to fall, but the root cause of the dry scalp. So a dry scalp can be dry, or you can have dandruff because you've got candida. That's normally slightly smelly dandruff. It might be a little bit greasy or yellow. It might flare up when you have sugars or the wrong foods. It will get very, very bad around ovulation. You might also have thrush, and you might also have some gut issues. Candida will cause your hair to fall out. So candida is a fungal infection, and you will get that hair loss. Just slightly dry, it shouldn't affect it too much. Having said that, if it is slightly dry, there might be some essential fatty acid depletions, so you may need to work on that. If you have got a dry scalp, you need to be moisturizing it as well, because everything needs to be nice and moisturized and nice and supple, so that the minerals and the nutrients and the herbs or whatever it is are getting into the hair follicle. The key is the hair sits in a little root like this, it's in a little basin, and all those nutrients are there, and you want to make sure they're getting there as easy as possible. If you've got very, very dry scalp, that can be damaging the hair follicle. So you just want to make sure you're having essential fatty acids. Omega-3 would be fantastic for a dry scalp. Zinc is great for a dry scalp. And then identify if it's either a parasite or candida. Parasites show up on the nape of your neck. You can get that very dry, red, itchy, just down here on the nape of the neck. You get a funny thing there. That's normally blastocyst or parasites. When it's candida, you might have candida itchy ears, you might have a white tongue, you might have sinus problems with candida as well, itchy scalp with candida. As soon as you have some sugar, you might get an itchy scalp as well. So figure out if it's candida, or if it's just a dry scalp due to low essential fatty acids or low zinc. Zinc is one of the best nutrients for the hair, to be honest. If you're low in zinc, we know that low zinc, white marks on your nails, low zinc comes with low iron, because you need zinc to absorb your iron. So if you've got low zinc and you're taking iron, it's not going to do anything. You need to be taking the zinc first. So if you have problems with your hair and with dandruff when you're eating foods you're intolerant to, there's a couple of different things happening. So when we eat foods we're intolerant to, that can cause leaky gut, which can cause inflammation, and it can also raise cortisol as well. When we're intolerant to foods and we eat them, there's a whole process that's happening in our gut that would be flaring things up. But here's what could be happening if it's causing it to become oily. I think I'm losing my voice. If you eat a food you're intolerant to, it goes into your gut. You have what's called leaky gut. The proteins of that food go through the gut. That raises your cortisol. Your cortisol spikes. When your cortisol spikes, it also spikes your insulin levels. You've now got hyperinsulinemia. Hyperinsulinemia can lead to estrogen and testosterone dominance. So you can kind of get that. So all because you had that food. This is why when you eat foods that you're intolerant to, you can get heavy, painful periods. Take those foods out and your period can be just fine. It's a knock-on effect. When you eat a food you're intolerant to, it's not just affecting you in your gut, it's affecting you systemically, and it's affecting the hormone cascade. You eat gluten, you're sensitive to it, proteins go through your gut, it raises cortisol acutely. That cortisol raises your glucose, high glucose raises your insulin. You've now got hyperinsulinemia, and that hyperinsulinemia will cause polycystic ovarian syndrome, endometriosis, estrogen dominance, and then that can affect your hair. So you've got a cycle here. If you know you're sensitive to foods, try not to eat those foods before you've fixed your gut, and then hopefully you can bring some of those foods back into your diet. But that's why when you're sensitive to foods, you've got to be leaving them out until you've actually worked on restoring your gut and making sure that you are actually sensitive and identifying that. So I hope that helps, but does that make sense why there would be a cascade reaction there and why it's important to leave those foods out for your hormones? I hope that helped. So I did get a couple of other questions. I think I just answered a question. I'm gonna go a little bit deeper on polycystic ovarian syndrome and hair loss because it does deserve a bit more time, and I will put a protocol together. I am going to one more thing. Other areas. A diet low in nitrogen. Okay, so a diet low in nitrogen. So a diet that doesn't have any nitrogen would be a diet that has no legumes, no grains, no proteins, no eggs, no things. So that can be like a vegan diet that doesn't have any grains or legumes. So you need to make sure that you're getting enough nitrogen in your diet. so enough nitrogen in your diet. Also, low protein diets, low fat diets can also cause issues with hair loss as well. And also low carbohydrate diets like keto diets where you have no carbs can cause that kind of anagen failure as well, and you get that kind of shedding. It's like stress to the body. So I hope that helped. With psoriasis, it will worsen with some foods because of that leaky gut, definitely. So working on the gut first will support. So when you've got psoriasis, if it is true psoriasis, there's psoriasis and there's what looks like psoriasis. Psoriasis is an immune response, can be an autoimmune response, and then some people just have what's called just like dry scalp. So if it feels like it's on the nape of the neck, that can be a parasite. Anything when we've got parasites, if we have foods that we're sensitive to, that can make things worse. So I definitely cutting out those foods that flare up psoriasis, taking zinc, taking foods to support your gut, and then hopefully working them back in. Dairy is one of the biggest foods that will cause dandruff, psoriasis on the scalp, flaky scalp problems. So dairy is huge when it comes to that. So there we go. There was a lot there. I'm going to have to break it down further because I know it can sometimes seem a bit confusing and there's a lot of info. So I'm going to work on just breaking that down, doing polycystic ovarian syndrome and hair loss separately. And then if you've got any other questions, let me know. If there was nothing that I worked on there, anything you found helpful, anything else you need to know, just pop some questions below and we can go a little bit deeper on this. Happy to over the coming week. So have a great day, guys. I'm going to leave you now. I'm getting a little bit of a lost voice now. Have a great day and I will talk to you soon. Bye-bye.